button, and then if you just want to talk to me.
Okay. So what we've created is the shoe slide.
Hang on. Go ahead and start with your name.
Okay.
And my name is Saprina Butler, blah, 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 and then tell me about it.
All right. My name is Saprina Rene Butler. I'm a nurse here at the VA. I've been with the VA for 11 years. I worked in physical rehab for 7 years, and during that time I worked with patients that had lost mobility due to the inability to lift their leg, either from stroke or another condition. So I invented the shoe slide to make the transfer easier and to allow patients to walk without needing to bring their foot off the ground. With the shoe slide, we've reduced the friction between the foot and the floor, and so we no longer have to get that toe clearance. The foot will slide and go across the floor smoothly and keep the patient from throwing the limb out. When they throw, they lose balance, and that also creates problems with walkers or crutches because they don't have that counterweight to keep the walker or the crutch from tipping. So we no longer have to have that counterweight because we're not throwing. So they are able to use crutches, they're able to use walkers and maintain that upright and that balance. It also allows the therapist is able to keep their base stance, and when they're correcting the step of a patient, they can take their foot and just slide and move the patient. Before, your options were to either lose your base stance, which is dangerous for you and the patient should we have a fall, and just really grind that foot in to move the patient's foot, or to let go of the patient, bend down, try to move their foot, which is dangerous for that patient as well because it takes away their stability, or have a second person with you that while you're holding on, they have to reach down and try to move the foot. So we've kind of combined all these things that allows the patient to do it in one natural flow motion. If there is any correction, the therapist or the staff member on the floor can easily just scoot the foot and correct that step and create that flow. Another thing that it did that we were proud of, motivation. If you're trying to learn to walk again and you're constantly stumbling, in your head you're thinking, I'm not doing it, I'm not doing it. But when we allow for that constant smooth flow, the patient gets that motivation of, I'm walking, I'm doing this, this is working. If I continue to go to therapy, I'm going to reach these bigger goals. So it's done a lot with the movement and the motivation and making things easier, safer, and it's very cost efficient.
That was perfect. Okay. You got your spiel down just perfect. I'm telling you, that was nice.
This device on my feet is primarily a piece of equipment that allow me to shift whenever it's needed, and then it also give you a little grip, because at the bottom of it there's some grips at the bottom of it that kind of hold you, and it doesn't cause you to slip it off. Even when you're walking, you'll notice that it'll slide depending on how you want it to go, not how it's supposed to go, because however you want it to go is the way it's supposed to go. It's just a two-step operation, front, back, and pull. One thing about this piece of equipment, you won't go wrong by getting it, because it'll allow you to do exactly what you're trying to accomplish